A little device is giving people at risk for a stroke some big peace of mind. It's called the Watchman, and it's become a more frequent option for people with a heart condition called atrial fibrillation. In tonight's 2-Year Health Report, 13's Melissa Bruner explains how it works.
Jim Travis felt life take a step back a couple years ago.
I was building a raised bed area, and it was just taking me forever.
The avid gardener felt rooted in place.
I was feeling real tired all the time, and my heart felt like it was fluttering, like a bird fluttering in my chest.
His wife convinced him to see a doctor who immediately put him in an ambulance to the hospital. Jim had atrial fibrillation, or AFib, a certain type of irregular heartbeat.
They were fearing that a stroke was imminent because of the way my heart was, that I was going to get blood clots.
With that left atrial appendage, when you're in atrial fibrillation, it's just sitting there kind of quivering and not contracting. So the blood can get in there, pull, form a clot, and that clot can go to your brain, cause a stroke.
Dr. Alan Helmbold at the Cotton O'Neill Heart Center says blood thinners have long been standard treatment to prevent clotting, but they carry risks.
Because as you get older, your risk of bleeding increases. In the Midwest, we have lots of farmers. And some of them have a lot more bleeding risk because of all the equipment they're working on, dangers of falling off farm equipment.
That's where the Watchman comes in. Doctors use a catheter through the leg to insert the device over the entry to the left atrial appendage, the source for 90% of strokes related to AFib.
So the idea is that once it's in there, it closes off the appendage. Then you don't have that appendage as a source for stroke.
Patients are usually out of the hospital the same day as the procedure and off blood thinners in 6 months. Jim had his procedure last summer.
It took me off of the most expensive medication I'd ever been prescribed, and now I take, instead of it, I take a children's aspirin, and it's chewable and actually tastes quite good, so it's not a bitter pill to swallow.
And those raised beds are back in business.
It's fun now when we go out and use it and remember and think about all the things I've done since then and how much easier it is for me to do it.
Melissa Bruner, 13 News.
Stormont, by the way, has done nearly 900 Watchman procedures since starting that program back in 2017. The device itself has seen improvements, making risk of complications even lower. Still, insurance coverage does vary. It's not for everyone, so talk to your doctor.